Hi, my name is Dr. Cirecie West-Olatunji, and I am Professor and Director of the Center for Traumatic Stress Research at Xavier University of Louisiana. Today, I'm continuing the series of 10 interventions with children who have experienced trauma. Today, we're talking about puppets. Now, puppets are something that we often think about when we're working with children, but we have some very nuanced information about working with young children, roughly between birth and about 5 years old. So what do you need? You need puppets, and then you need either a list of probes, questions, statements, or you need a script. So if you're going to engage in dramatic play, you probably need to create a script ahead of time so you know what you want to cover. So the first option is to develop a script related to the clinical issue and then use the puppets to present a scenario for the child to observe and respond. Typically, when you use this option, what happens is you're talking about the presenting problem, and you may be presenting the child as the child is. Or you might want to create a scenario in which you have the child to resolve some of the emotional issues that they are presenting. Often when you're doing this, children are going to engage with you as the puppet, and they will either laugh or they'll make comments and so on. I recommend that you also record the session so that you can take a look at some of the dynamics between you and the child and the puppet, and be able to make comments. Option 2 is that you develop a list of probes, and so that you as the puppet are asking questions of the child and you want the child to respond. Again, I would recommend that you record the session so you can go over it, study it, and make notes. Now, the purpose of using the puppets is that you allow the child to externalize the problem so that they're not thinking about themselves. Instead, they are projecting it onto the puppet. Also, in engaging in this kind of play using the puppets, you create a safe environment for the child to be able to express themselves and ask questions. Also, it helps to relieve some of the anxiety and discomfort that children might have emotionally in responding to the traumatic event. Also, it allows the child to talk comfortably with an adult about the issue, the problem, the traumatic event, how they're feeling, and so on. So it helps them to create dialogue about the event. It also helps them to normalize any feelings that they have. So they may be feeling shame, they may be feeling anxious, they may be feeling sad, depressed. But what you can do using the puppets is to help normalize those feelings. And finally, it creates an opportunity to restructure the problem and pose solutions. So again, in creating a narrative and developing this script, what you can do is to resolve some of the issues through the use of the puppet to offer alternative endings to the problem. Now, some of the benefits is that, of course, once again, like all of the interventions that I'm presenting to you, they're both child-centered and culture-centered. So again, we're relying on the child and the family and the parent or caregiver to be able to talk about the issues, to create narratives, to develop a script, and so on. So the child is speaking from their own experience. It's non-directive. Again, it's wide open. We're doing this kind of authentic assessment in which the child is just freely speaking and talking. It also, as with the other activities, creates a safe environment for the child to recollect events, to be able to talk about the traumatic event, to be able to share their feelings, disclose their feelings, and to create a narrative around the particular traumatic event. And so in this way, it is also narrative like some of the others. Now, for some of the challenges to using this particular intervention, for children from birth to about 2, animal puppets can be scary. and I've experienced this in working with children where I had animal puppets and they work well with 4-year-olds, sometimes even 3-year-olds. But for a 1-year-old, 2-year-old, they start screaming. They're very fearful of this. So I learned through experience that, and by also consulting with early childhood providers and educators, what kind of puppets might be more appropriate for very, very young children. Also, it's also challenging to develop a script. This is not something that you can do very easily. So it's something that you need to work on and develop a skill at developing a script for young children that are related to the presenting problem. And then finally, some kids are just not into puppets. And so you might try this and it's just not for that kid. So let it go and do something else. Based on some of the things that I've talked about, if we think about skill level where 1 is a beginner, 3 is an expert, this would be a level 2. I would say once you're a licensed therapist, you've had enough experiences so that if there are any triggers to working with any of the puppets that you can easily handle it. I don't think a graduate student or someone who is just a beginner at this will be able to do it very well. So I recommend level 2. As always, I like to provide a case for you that might be ideal for working with puppets. So this one is a case I had of a 3-year-old Korean American male child who's referred by his child care provider at the preschool. And this particular kid was referred because of biting. He was biting his peers and often was biting the staff as well. So they were very concerned about this and they asked me to come in as a consultant. And what I learned with this one is that the child was dealing with grief. And so there had been a loss. I believe that the mom had had a miscarriage and they had really involved the child in the anticipation of a new brother or sister. And they didn't think that the child would really have that kind of reaction, but the child did. And so we were able to do some grief work with this little 3-year-old, and we were able to resolve many of the issues that he was having. So now that you've learned how to do this, you need to get out and do it. So first, create or purchase your puppets. And of course, I think you remember creating puppets from socks. You can do it. So you can get an old sock and you can use scraps of material to put that together, some buttons and so on. You can use some markers or whatever, create your own puppet. Definitely develop a script or find a book and then practice with a colleague or friend or family member and then process. As always, I'm very interested in hearing, how did this go for you? Did it work? What are some of the stories you have in working with your clients? Email me, call me, go on our website for more resources, and of course, follow us on Twitter and Instagram, and that's at XULA_CTSR. As always, I am so appreciative of the New York University Bob's Library, Digital Studio, and Faculty Resource Network staff. Thank you so much, and I'll see you next time.